Hello! In this video, I'll be answering the most frequently asked questions about Ritalin, a commonly used medication for attention deficit hyperactivity disorder, ADHD. If you find this video helpful, don't forget to like and subscribe to support my channel. What is Ritalin? Ritalin contains the active ingredient methylphenidate hydrochloride, a stimulant that acts on the central nervous system. It is primarily used to treat attention deficit hyperactivity disorder, ADHD, and narcolepsy in both children and adults. How does Ritalin work? Methylphenidate works by increasing the levels of dopamine and norepinephrine in the brain. As a result, attention span improves, impulsivity decreases, hyperactivity becomes more manageable. How should Ritalin be taken? Usually taken in the morning and at noon. Can be taken with or without food. Swallow the tablet whole with a glass of water. Do not chew. Never exceed the prescribed dose. Typical dosage: start with 5 mg daily. The dose may be increased depending on the individual's needs. Maximum dose: 60 mg per day under medical supervision. How long is Ritalin used? The duration of use depends on individual needs. Some may take it for years, others only for short periods. Doctors sometimes recommend a drug holiday during summer breaks, especially for children. What should you be careful about when using Ritalin? Always use under medical supervision. Regularly monitor blood pressure and heart rate. Growth should be monitored in children on long-term use. Avoid alcohol. Do not use without a prescription. Who should not use Ritalin? Ritalin is not suitable for people with severe anxiety, tension, or glaucoma, serious heart problems or high blood pressure, use of MAO inhibitors in the last 14 days. History of substance abuse should be evaluated carefully. What are the side effects of Ritalin? Like all medications, Ritalin can cause side effects. The most common ones include headache, decreased appetite, insomnia, nervousness or anxiety, stomach pain, heart palpitations. Serious side effects: rare worsening of tics, psychiatric symptoms, anxiety, depression, blood pressure issues. If you've used Ritalin or are considering it, feel free to share your experience in the comments. Your story could help others too. If this video was helpful, don't forget to like and subscribe to support the channel.